content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis. Hello, I'm Ryan Alford, your co-host, joined by my friend and business partner and co-host of the show, Chris Hansen, who's at the Vacay Lounge in Miami. What's up, Chris?
How you doing today, my man?
I'm good. Every day's a vacay, as we say around here. V-A-Y-C-A-Y, the only way to vacay. Speaking of, I guess it's all a vacay when you're a doctor. You know, the good doctor. At least without your pretend so. You know, doctors and lawyers have it so well, right? Joking. But Doc, it's great to have you. Dr. Patrick Flynn, CEO of The Wellness Way and author of international bestseller, I Disagree, How These Two Words Are the Secret to Thinking Differently and Taking Control of Your Health. Thanks for being here, Doc.
I appreciate being on. Excited for today.
Yes, we're excited to have you. My friend Chris Hansen found you on, what has become the way we find people, right? Social media and everything, the way the world works. And it's also made what's been so great about this show, getting to talk to a lot of people that are changing the game. And, like your book says, thinking differently. Yep. I think that's a lot of the foundation of your work, isn't it?
Yeah, it's all about perspective, and it's like, and even statistically, I think we do need a different perspective, because if you look at the rates of cancer, diabetes, infertility, heart disease, every condition on the planet over the last, let's say even statistically over the last 40, 50 years has dramatically gone up, not slowly, dramatically going up. And I've said the same thing for 25 years. It's not a joke. 25 years, I've said the same thing. And if people don't have a different perspective, 25 years we'll be just having to talk about the same exact thing.
Yeah. And a lot of our show is built on the foundation of different beliefs and not believing everything that's mainstream. We like to say we're making alternative wellness the only alternative. And it's just, we get led to believe by media, government, other things. We get led down the herd path. And when there's always a different perspective, and it's not just to be contrary for contrary's sake, it's just that we all need to understand that there is new technology, new approaches, new learnings that come from people that ask questions the way you did.
Yep. And I think that the worlds can coexist if you understand, what we are all supposed to accomplish. And the example I always love giving to set the premise for everything so people may understand me a little bit more. I think people are too tribal. I think people are too tribal in the natural world. I think they're too tribal in the medical world. And realizing that, when I'm sitting there talking to a person that might be a medical doctor, they act like, a person that has a natural background, got their education from a Cracker Jack box. On the flip side, you actually have the all natural people that's saying drugs are horrible. And I just say to them, I said, have you ever had a cavity and actually you ever done dental work with no Novocaine? And they're like, well, no, here's the exception. And so what happens, so I had to come up with an analogy that really set the tone for everything I believe. And then when I speak at a medical school, or speak at a chiropractic school, or speak at a pharmacist convention, what I recently did, or speak at a chiropractic convention, I would tell people, I said, you got to think of healthcare as one term, but you got to look at multiple things. And I said, I want you to picture that all of a sudden one day your house caught on fire. And no professional to put out that emergency situation is the fire department. Well, they're by far the best professional. You never call your dentist, even though he's a professional, but he just doesn't do that. So the fire department's going to come there, they're going to use their axes and hoses, and through the process of saving your house from burning down, they cause some destruction. The water damages the wall, the carpet, and everything, but it does stop the whole house from burning down. The axe, what they're knocking the windows down, knocking the door down, guess what happens? They're going to save the house, but through the process, there is some damage. Now, if the fire department did a really good job and put out the fire, you'd never ask the fire department to stay around and help you rebuild your house with an axe and a hose. It makes no sense. You need a different professional. So you're going to call a carpenter. Now, a carpenter is going to walk into the same house with a different perspective and go, because the fire department will walk around going, hey, Ryan, guess what, man? Hey, Chris, I'm good at what I did. I saved even your studio from burning down. But the carpenter is going to have a different perspective. He's going to say, listen, cool, they saved your house, but we need to rebuild this, bring in all this raw material, bring in new lumber, bring in all the new carpet, do everything that way, and get it back to normal. And if you can think of that example, you can understand where I built a whole company and where I believe, once again, that the medical and the natural world can really respect each other, because here's what happens. If, Ryan, you have a heart attack or stroke right now, I don't want Chris to grab a knife. Go to the emergency room. Drugs and surgery, axes and hoses, call medics in the fire department. Through the process of saving your life, there's some destruction. Don't believe me? Every drug, regardless if it can save a life, does have negative side effects, okay? Just like spraying water on the walls. On the flip side, let's say the drug didn't save you, you got surgery. Can a person possibly even die from a surgery? Absolutely, but it's meant there to help to put out the fire. But even if they did save you, you can't rebuild a house from a drug or surgery. You can't rebuild a house from an accident hose. You can't be healthy from a drug or a surgery. It's impossible. It doesn't even do that. So you need carpenter-type practitioners, carpenter-type doctors. So what I did is I took the whole realm of the world from my education, my background, said, listen, God bless you guys. Medicine, the only sad part is this, you have, especially COVID proved it. They thought, well, we're just gonna use axes and hoses to deal with the virus. Well, how will they do that for us? You say, and on the flip side, fires are preventable. So people like us that are carpenter-type doctors going, man, you let that house rot, it's gonna catch on fire. So I think that's the perspective I want people to always go forward when they hear me speak. So if I talk about hormones, it's from a carpenter standpoint. If I talk about immune systems from a carpenter standpoint, the only thing that we get on media, and we were censored, if you didn't speak more fire department language, you were called a quack, misinformation, all things like that. So no, but listen, carpenters have a realm to do in this world too. Just because the fire department can deal with your house doesn't make them the professional to keep a good house. I'm sorry, I don't mean this in a negative way, and I employ people like this. I employ medical doctors and nurses and nurse practitioners and all medical people, and they will tell you right out, a drug and surgery can never make you healthy or keep you normal. It just stops your house from burning down. So we need carpenter type people.
Yeah, it's a good analogy, Doc, and I think we talk about this all the time, but these arbitrary lines get drawn with these things are good and these things are bad. And it's, at some point in the world, we used natural supplements and different things to treat almost everything that we did. And then, modern technology, laboratories and pharmaceutical companies come along and they've done a lot of good things. But we've created these arbitrary lines between what's good, what's acceptable, what's publicly, the norm, and the things that aren't. And some of that might be necessary, but it's just crazy in our world that those lines get drawn. And it's so enlightening that, we're seeing, this growth in these areas where hopefully the analogy you just gave is starting to become more acceptable. What do you feel like has been your role in trying to break down those walls?
Same thing. Your podcast is a perfect example. It's just trying to give people to think a little bit differently. And let me go back to this, because you know why medicine really got so popular? You understand, if you look at the history of healthcare, and see, I believe that I'm a big history buff. You're gonna laugh at this. I'm obviously, my world is healthcare, but my secondary world is politics. Okay, because I absolutely love it. Okay, because why? I'm a big history buff, and you can't understand politics unless you understand history. Well, the reason why medicine, got its props, which I think it should have. You're gonna laugh at this. One of the things that really, if you go back to all the natural world and how we had herbal medicines all for centuries, well, here's what happens. The number one thing that really killed people the majority of the time through early history was actually accidents. They say, well, people lived longer. Yes, because you know why? Because all of a sudden there was a birth that was bad, and all of a sudden, because that can happen, and now the child died at 1 day old, and then you take a 50-year-old and say, look, at the average lifespan is 25 years. So what they did is they created modern medicine, which actually was fantastic. Antibiotics did save a lot of lives. I hate when natural people say antibiotics didn't. Yes, it did. It put out the fire, so now it looked like our life expectancy was so large. Well, the reason why it looked like so large, there's people that lived to over 100, 200 years ago, 100 years ago. They act like people are all dead by the time they're 25, 100 years ago. That wasn't true. It's just that a lot of people did die young because we didn't have emergency medicine. But what happened is it became such a shift, and it became such a profitable industry that what happened is this, it now became the dominant form. And now we're seeing the consequences of that. We've seen the consequences of not having emergency medicine. Now we see the consequences of trying to apply emergency medicine to as far as a realm of healthcare. See, so we're in that pendulum shift. And I've just been consistent the whole 25 years. That's why I can speak to both sides and saying, don't be on one side or the other, because you're going to be wrong sometimes. And so therefore we saw that during COVID. It was a perfect example. Because to look at those things, so all we try to do is share information so people know this. But here's what happens. You gotta understand, getting a person to change a belief that they've been ingrained their whole life. And you gotta think of it this way, everybody's been trained to be a drug user since they're little. Don't get me wrong, your mothers do it. Don't feel good, take this. Don't do this, take this. And everything is a take. And all of a sudden your child gets broken up with, you have a daughter gets broken up at 17 years old from a boy, and now she feels bad and never realized that, guess what, sometimes you're gonna feel bad. Then the child runs towards something bad, a drug, or becomes addicted to something. It's like, you train them that way, because we've even taken away from a fever or a sniffle that if they feel bad, we gotta do something to comfort them. So really what it comes down to is actually showing people the perspective and the thinking that they need to do to actually accomplish what everybody wants. And everybody wants to be healthy. If I were to ask everyone on this podcast listening, said, raise your hand if you want to be healthy, every person would raise their hand. Raise your hand if you want your kids to be healthy. Everybody raise their hand. Raise your if you want to, you pick every person, the person they love to be healthy, they'd raise their hand. But you're going to find out most people don't know what health is. So therefore, because we've been so conditioned on diseases and also emergency medicine, that we think they are the experts that are going to lead us to us. Just because a cardiovascular surgeon saved your dad does not mean he has any understandable health whatsoever.
Nailed it. And would you say this, Doc? We've talked about it, getting back to your analogy and just really framing this up for like our listeners. Yep. Would you say that what we're talking about, because I talk about, my doctor's a longevity doctor, and had him on the show, Dr. Joel, and also known as, he literally is Dr. Longevity. He's on Instagram, but and he's in a sort of a different field, a broader field, but it's really about treating the other end of prevention, right? Like, instead of using, like you said, the analogy of putting the fires out, it's how can we best prevent the fires to begin with? Isn't that what we're talking about?
Yes, and if you think about it this way, but here's a premise I think you have to come for, first of all, to even understand longevity. Because I believe, now remember, this is where I will say this, and I've looked at all the healthcare professions, everything from Chinese medicine to acupuncture to chiropractic to medicine, everything that way. You have to look at their foundational beliefs. Now, this is not a joke. If you ask even today's longevity, now remember, if you look at, I will give you just my education in immunology, nutrition, and chiropractic, and obviously I have other postgraduate degrees, but let's talk about this, is how you view something. For example, I have a picture of a 90-degree wall, and one has a square on, one has a circle on cylinder. And really what happens is they're arguing about square. It's like the person that, let's say if I had a 9 that was shaped like a 6, and you said 6 and I said 9, it's all from your perspective, okay?
Right.
Now, and I think one of the major premises that set it apart, and let's go to functional medicine, let's even go to some natural people or even medical people. And if I were to say that you suffer from an autoimmune condition, the natural world and the medical world, and I watch these people do it, and longevity experts say, oh, look it, your immune system made a mistake. Now, do you understand? And I will tell you just from my background in immunology, and that's why I was so avid about the stuff with COVID and all the vaccine stuff and everything like that. But here's what happens this. Your body never makes a mistake. And if you can't start from that foundational principle, you can't figure out some of the stuff that I figured out. You can't even approach it, because then you think that you're smarter than the body, and we don't even understand when you cut a finger how it gets all those cells perfectly there. I think we've lost that. And so when people tell me the body made a mistake, I'm like, you're clueless. You're literally clueless. Okay, so what mistake to make? Well, the body attacked that cell. Okay, why? Well, we don't know why. So just because you don't know why doesn't mean you made a mistake. And see, this is the premises. So that's why I watch all these people going, so it's not really about prevention. You have to stand from a standpoint going, this is an intelligent thing that constantly coordinates without your even perception. And here's what happens this. And even if you try to work against it, it's gonna force you to do it. Don't believe me? Everybody hold their breath right now. I'm gonna do it for so long, your body's intelligence say, I'll make you do it. Do you say him? And so that's what I've always recognized. So when I look at a lab, I'm like, and here's what happens. But I will tell you this. Well, doc, then where did diseases come from? And I will tell you this. Diseases are a longevity survival mechanism. If you didn't get a disease, you would have died already, because your body's made to adapt to all the situations it's presented with. You're in Miami, I'm in Green Bay. A month and a half ago, it's 35 below here. So let's say you and I, we all got down to our skivvies, got a Wellness Way green Speedo on, okay? And we walked outside Green Bay. Now, we made a dumb choice to walk outside at 35 below in a Speedo. But now our body says, I'm intelligent, I need to adapt and survive. So what I'm gonna do is I'm gonna take all my blood and pull it towards where?
The skin.
My core. Okay. Even to the point of where you will lose your fingers and toes to save your heart. Was that a mistake, or did the body make an intelligent decision? See, so therefore, when people tell me that the body made a mistake and it's unintelligent, made this, I'm like going, man, I'm sorry, that's a set of arrogance that I'm going, all right, I disagree with you. And so then when you look at a hormone lab, you look at an immune lab, you look at all these things, and look at the last 3 years. We treat it like it's this major mistake, and we have to come up with some outside non-intelligent chemical to help survive a little protein. I mean, think about that. It made no sense. And I'm sitting there laughing, but also crying because what they did to the public. But that's where I think what happens is this, because people think longevity is I live longer. There's people that, for example, are 80 that really died at 30 and they've had no quality of life. Longevity should be based on your performance and your function. Oh, wait, there we go again. There's the definition of health, how well you function. Do you know what I'm saying? And so you got to start from a strong foundation. So when I ran a lab, you know what a lab is to me? And this is where people think it sounds weird. Do you understand an exam or a lab are just an observation of what the body's trying to tell you? That's it. And here's what happens. And I figured out that there's 3 major things that really stress the body out. Trauma, toxins, and thoughts. And I will prove to you without a shadow of a doubt that women probably have more detrimental to producing disease based on their thoughts than anything else. And men, I think they do a little bit more of some toxifying things that really do it that way. But because we're different male and female wise. And that was another thing in the whole public over the last 5 years in politics of thinking that men and women are the same. I'm like, biochemically, you can inject testosterone into a woman, and if you stop doing it, it will bring it back to its normal physiological levels that's supposed to be, regardless of what you think you are. So I know I encompass a lot there, but yeah.
What, I know, I'm like taking notes. Like literally more for myself than you listeners. If you get something, I don't really care because I'm getting a lot. So we know they are. Chris, I know you've been following Dr. Flynn for a while, so I want to open it up to you for certain questions before I jump on a couple other things.
Oh, I just think it's fascinating. Everything you just said too. It's stuff that I agree with, but I've never quite heard it put that way. And I felt that was very powerful, especially us having zero faith in our bodies. And even myself, I went through a period of substance abuse for about 10 years with, pain medications and alcohol and subconsciously for a long time, even after getting sober, I still was like, you're not healthy. You've done all this damage. There was just a belief. And that was a huge part of what I had to break through, was just realizing how powerful the body is and having belief in it.
Yes.
And you see it all the time with people, with real problems, right? Like adapting, like there's another, I forget his name, Nick Sanatosa, maybe. He's a kind of an influencer, but he's got no arms and legs, and he's doing motivational speaking with Tony Robbins, where you see stuff like that. And it's like, we are so adaptable and intelligent. The body is just unbelievable. But like you said, it almost starts with the belief. And it's funny you said that. One thing you said that really stuck out, because I saw it on a video this morning. People they die at 30, but they really pass at 80, right? Yeah. Like physically, emotionally. But what you said about the belief, I was in the sauna yesterday, and there was another guy I see quite often doing breath work. And I was like, hey, what's your breath work protocol? You're one of the only other guys I see doing this kind of breathing. So I was kind of like, what do you follow? And he said Wim Hof. But what he said was, part of it is I think I just believe it works. And at the very basis, and I've heard the same thing with meditation. Everyone can meditate, but unless you believe it, it's not going to do much for you.
Well, and they've studied this so much too, and that's why a lot of people say, well, doc, some of the things that you could be doing are placebo. Actually, you understand, so are drugs. Sometimes just by taking a drug, you can believe it can work, and actually your body will respond. and I want to bring this back to this way, because I didn't get to finish this point. When you actually look at the body adapting to that stressor, so let's say that our thyroid couldn't adapt to that cold when we walked outside. Do you understand that we immediately die? Because we go into hypothermia and die. So our body could not actually adapt. So in order to adapt, we develop a disease process to make us survive longer. Do you know what I'm saying? So when you actually understand that disease is a survival mechanism, and you're going to say, but doc, but eventually you can take over your body. Absolutely. But if you couldn't adapt right away, you would have died instantaneously. And see, so you look at the body and go, oh my goodness. And then the cool thing is this. And you talk about breath work and all things like that, which is absolutely fantastic. I mean, and you think about it this way, one of the greatest ways to actually even reduce stress is breathe. Breathe, control your breathing. You know, because if you even look at a stressed out person, if you want to put your body in stress, start to breathe like a stressed out person. And your body will physiologically respond to it. It'll adapt to what's going on that you're stressing out. So that's where it's like, and if you really want to be fascinated by the intricacies of the human body, look at the female body. Oh man, I'm obsessed with the female body. If you understand just even what it takes for a woman to ovulate and all the interconnections and all, and I love analogies, so I loved creating my fire department carpenter, but I also say, listen, another way to understand this, and think about this, the body's like a Swiss watch. All the gears interact. They do. And if you look at our current form of healthcare, they specialize in gears and they don't even realize that they're talking. That's why you have a heart specialist, a liver specialist, a foot specialist. And I can say this, foot and heart specialist say, guys, you need to correlate. Why does a podiatrist need to correlate with a heart surgeon? Well, it's really funny because your big toe controls your heart. Don't believe me? Smash your big toe. What happens to your heart rate? It goes up. So is your blood pressure. So is your stress hormones. So all these things interact. So the body's like a Swiss watch. So therefore, you could have a mental stress and it can affect your liver, your big toe, your right eye, your left finger. You could actually eat something bad. It can affect every other gear. You could have some form of physical trauma, just like I talked about that toe. That's why I even love being a chiropractor. You hear these crazy stories. Man, I got adjusted and this problem went away. Well, that's only if that was the stress that contributed to why that body was trying to adapt. And so you start to look at that, you start to go, I can now start to winnow down the stressors in people's lives. And you'd be surprised what I figured out clinically and what I noticed on labs. I was like, oh my goodness, women are so stressed out mentally today. And I started to realize that going, my goodness, and males are dramatically different because their physiology and biochemistry even expresses them being different. So the human body is just a fascinating thing. And if we don't come from that standpoint, even research is going to look at it very differently.
So real quick, kind of to simplify what I'm hearing is if your body's in a constant state of stress or a survival mode, that is ultimately what's causing these chronic diseases, is being in a constant almost fight or flight.
Yeah, it's been shown. See what they do is this. So for example, I watched the carnivore and the vegan people fight over insulin spikes and things like that. I'm like, oh, no, listen, sugar high acutely, it's fine. Sugar chronically high is bad. So what you have this, so you see these people that don't understand sugar, they go, all sugar's bad because your insulin spikes. Well, insulin spikes after eating fat. You understand? So what they do is they try to micro look and go, no. Listen, if you have a spike of insulin, that's fine for a short time because your body's going to adapt to everything you put in there. But the flip side, if it's under constant bombardment, for example, I want to do me a favor. Both you guys suspect are married or at least have a significant other. I want you to do me a favor tomorrow morning. I want you to put a pebble in their shoe. Little small pebble, just a little thing, in their shoe and let them walk around all day and tell them what their mindset's like at the end of the day. See, most people have pebbles in their life and they think there's something dramatic that leads to that adaptive physiology, which aka results in a disease process. So it's our job as, let's say, the natural realm, because the medical realm actually puts stress on you. Don't believe me? Do you understand the definition of a medication is? A medication is a non-lethal dose of a lethal substance. It's a stress. That's why there's so many side effects. That's why there's no such thing as safe and effective. Okay? That's because constant safe and effective. What do you mean? Because you don't see a fire right away from taking something, or you don't see a fire right away. And when you do see a fire, they say, well, it's a small percentage of people that does it. No, you just are throwing a match or letting a wall rot in a house. Go back to my carpenter and fire department example. And so that's why I see you. So when you think about from this standpoint, it's easy to walk through. So when I walk through and speak at medical conferences, like, Doc, you've got it all figured out from a thinking standpoint. Yes, because now we can walk in and there is times that I would tell you right now, and this drives all the natural people nuts. There's times where I see that you do need a medication. And there's times you're sitting there going, what the heck are you taking this medication for? It's ridiculous. See, that's where there can be a great synergistic realm, but you need people to have the first thinking. Otherwise, they get tribal and say, I'm all natural, I'm all medical. And we saw that during COVID. I sat there and going, I will tell you right now, I can run an immune panel on you and look at your CD4, CD8, your natural killer cells, all things like this. And there were some people that should have stayed home. There's some people that should have wore a mask. There's some people that could have, and guess what? On the flip side, you see my immune panel, and someone told me to test it positive. I told them, here's a spoon, put it in your mouth. And I put it in my mouth. I did it over 50 times. Okay? Because that little protein getting in my body was going to get destroyed by my natural killer cells and all my immune function. Yet some people that are low immune system, it would have killed them. See, so that's why you can't be neither camp. Don't be tribal, natural or medical.
Doc, when people come to the wellness way, talk to me about what that experience is, how you go about it, walk through kind of that, what people could expect or your philosophies and everything else that we've been talking about, how that's built into it.
Well, everybody comes in suffering some major condition, okay? And obviously, I'll just go back to my career, okay? Now, I just gotta make that very clear. I still see some patients, but having hundreds of doctors and offices all over the world, I don't get to be in patient care like I was in intense care for full-time for 20 straight years as I had offices all over the country. But running a big company, I actually step back some, but I still see some. But even to this day, I'll still deal with some. Like this morning, I was talking to one of my docs. I'm directly working with them because this woman is actually having some pretty severe fertility issues that way. And I have a love for that if you know my story, okay? Because I was told that my wife could have her kids when I met her, and I wasn't even graduated yet, but I had these concepts in my head, and I was working them out even in school. And obviously, now we have 4 wonderful daughters. When they told her she had her uterus ripped out at a young age and she'd never have kids and she was infertile. And from the medical standpoint, I agree. Their assessment was right in their perspective. You see, we think that because they're the expert in medicine, they're experts in health. That's where they get the thing wrong. So therefore, when a person comes in, no matter what they're suffering with, we all know this. It's the job of one of my people to figure out the stressors in their life that are contributing to their adaptive physiology. And once again, there could be trauma. You might need to get adjusted. You might need to actually have some physical work done on you. You might have some toxic. You got to rid all these. See, I love this. Glycophosphate is okay because, when they eat it, we don't see any major problems. We don't see a fire. Yeah, but you're causing the wall to rot. And you may have to eat it for 2, 3, 4, 5, 10 years before to even see an adaptive physiological response. Okay? And so therefore, there's toxic things, there's deficiencies, and there's the mental stress. So it's our job to figure out what are the major things that are doing it. And what I started to realize is you can start testing people to see where their body's in adaptive physiology, to see where their body is stressed out. And that's why I say it, and I keep going back to this because this resonates with women so much. Because I've always said, who stresses out more, men or women? And women are like, we do. I say, who causes women the most stress? They yell, men. Okay? Now, that being said, it's kind of funny, but I took that seriously going, holy crap. Because men and women's physiology is very different, and how estrogens affect women, how testosterone affects men is dramatically different, even how we run our day. And I didn't realize that was gonna be so popular, and that's what I got known for. But then I started testing women, and I realized that majority of labs out there, when you test women's hormones especially, they're dramatically incomplete. They're dramatically incomplete. They cherry pick a couple of them like going, how am I supposed to have a proper assessment on the person with an incomplete picture? Makes no sense. So I started calling up all the labs and they said, yes, we can do it, but why? And insurance doesn't pay for it. See, so that's why you have to get people to think differently because they won't pay cash for something they think the same of. They'll say, well, why isn't my doctor? I did a video the other day, got 1 million views, because I said, listen, how to get labs done? Ask your doctor. But he's not gonna do it. Because why? Because they are controlled, and once again, you understand, until COVID, things that I said, people call me a conspiracy theorist. I'm like, really? Now they think, oh my goodness, you're right. I wasn't trying to be right. I said, listen, medicine is controlled from the top down. Your doctor doesn't control anything. I have medical people that left the profession because that and work for us because they don't have to do insurance. Because they have to go, well, I wouldn't mind testing all your hormones, but I can't prove it to the insurance company why you need to do it, so therefore I'm gonna get in trouble, and they won't pay me, and I can get in trouble from my employer, so therefore I'm not gonna do it. Wait, I thought it was about the physical and psychological response to the person that you're taking care of, not the insurance company. And if they really believe you need it, just tell them that you gotta pay for it cash-wise. Can't do that. I'm like, yes, you can. They're sick, okay? But understandably, and even if they did run the labs, they wouldn't know how to do them in the first place anyways. See, that's where it's quite extensive of digging deep to the 3 T's of what's involved in each person's life. And here's what happens. I'm gonna tear a little bit on the natural world. I can never trust a doctor that promotes on his videos and says, I go after the cause. Come on, guys. Just by talking about the 3 T's, I've never met one person that has just one causal factor. There's always multiple causal factors, always, 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 always. And so because actually think of it this way, and that's why given a pill for one condition or something like that, it makes no sense now because there is no one direct effect to the body. The body's always adapting to all the stressors, and it's our job. And so let you talk about what it's like to see somebody. It's digging deep, individualized, and that's why natural medicine will always be more, a little bit more trying to be like a doctor in the medical realm. That's what's called natural medicine instead of just healthcare. Is they're going to try to correlate these things I can give somebody instead of really digging into the stressors that are involved in it.
What ultimately becomes the outcomes or recommendations from, you run these tests, you tell people,
Yep.
Look at these things but talk to me about some of those outcomes people can expect.
Okay, so let's just take a simple one I just had the other day. And this woman was suffering from extremely bad endometriosis. So I actually had a blood panel and a urine panel done together. So let me set this premise. This woman said endometriosis or PCOS. That happened the other day. So let's talk about those two major conditions. They have some similarities, but they have some major differences. And if you have PCOS, do not follow this recommendation. And if you have endometriosis, do not follow this recommendation because they're all different. Let me make that very clear. They're all different, and I'll explain very quickly just on PCOS because 1 out of 10 women are diagnosed with it right now. Polycystic ovarian syndrome or endometriosis, where you got thickening and some endometrial tissue, not only in the pelvic cavity, but can spread to other areas. But here's the point. Those two conditions are dealt with hormonal problems. We can all agree with that. It's very common to be in PCOS to be androgen dominant. What's an androgen? Testosterone, androstenedione, DHEA, dihydrotestosterone. And I'm so surprised that when women come in, they don't have those even measured. But those aren't even the vast majority of hormones. You also have your estrogens. Now, it's really funny. Us as men, we are dictated by one major hormone. Now, we have the same exact hormones that females do. We're just really dominated by the one hormone. And fellas, what is that hormone that we have?
Testosterone.
We know that. We know that. It's incredible. Now, if you look at females, they're dominated by a different hormone. What is that hormone?
Estrogen. Or
what if I told you estrogen's not a hormone?
Progesterone?
Estradiol.
I don't know.
See, now watch this. This is the confusion to the public. Estrogen is a term that represents many hormones. And so what I realized is that women, and people say, Doc, yes, you're right. There's E1, E2, and E3. Keep going. There's a bunch more. And I realized that women had no clue about that. And on top of it, no doctors are measuring them. So 25 years ago, I said, you know something? My wife suffered from endometriosis, cystic acne, ulcerative colitis, and cluster headaches. And they measured estradiol on my wife, one of many of the estrogens. How could I even take care of my wife having an incomplete view of the major hormone that could contribute to all those things going on? And the reason why they told her it was genetic is because her estradiol was normal. But then when I measured the rest of her estrogens, 4 of them were abnormal. And so therefore, they were abnormal because of many things. I tested her and she had a major dairy allergy. And here's one thing. Guess where she grew up on? A dairy farm. Do you know what it was like telling my future in-laws that you taking the milk even out of the bulk tank, which is raw? Now, they didn't do organic farming, so they still had pesticides to that. But they used to drink out of the bulk tank going, you were actually hurting your daughter? What do you think that conversation was like? So she was being toxic by a food substance that, in general, and I love fermented dairy. I'm not a raw dairy person. I'm a raw fermented dairy person. That's a whole nother topic, okay? But the idea is this. And so therefore, we needed to pull that stressor, that toxic stressor away from her. She couldn't even digest lettuce when I first met her. She couldn't. She couldn't even eat lettuce. She had such a minimal food that she could really eat. But so therefore, and let's go back to that PCOS person. The most common dominant hormone in PCOS, they think is testosterone. That's not really true. Is dihydrotestosterone, DHT, which is 10 times more potent than testosterone. And what happens is this, and what you find out is people do certain habits that can actually now stimulate the production of it, but then they're usually deficient in things for the body to metabolize that hormone out. So most people are toxic from things. Most people are deficient in certain things. For example, one thing that we're seeing now today, people think testosterone's at an all-time low. That's not really true. I'm gonna prove it to you. The majority of men, with the exception of taking a medication or having some major testicular trauma, produce significant amount of testosterone every single day. So we're not having, our testosterones as volume are still the same as it was before. We're just converting it into estrogens, and that's why we see so many man boobs and all the things that we do and all the characteristics, and men becoming more feminized, because we can aromatase those testosterone into estrogens, and we can take on female characteristics. Start gaining weight like a woman, start thinking like a woman, start talking like a woman, start actually being more emotional, start doing all these things, but our testosterone is being produced, it's just being converted. And a major contributor to that is actually an overconsumption of sugar for a long period of time. Well, look at the kids now today. They're freaking drinking horrible sodas and everything at such a young age right now. So by the time they hit puberty and everything like that, and what they're doing, their lifestyle, they got more adipose tissue ever in history now, which can aromatase your testosterone into estrogens. And what I just told you there was things that are lifestyle things that puts the patient under control. See, that's the thing. Medicine doesn't want patients to be under control because they want to be your authority and control of you. We saw this over the last 3 years. And if you don't believe what they do, we're going to just force you through government. See, so I can go through all these conditions and look at going, okay, this person's deficient here, this person's toxic here, this person has the stress that's here, this person has the trauma that's here. And that's basically by labs. It's really not that difficult. People overcomplicate it because you're trying to treat pathology and diseases instead of actually starting to normalize function within the body.
What's in the future, Dr. Flynn? Where's all this headed for you? You got the 80 the offices and all this stuff going on. Where's your path leading?
I wish it would lead to bankruptcy. That's funny. It's funny I'm gonna say this. People are always very excited or encouraged when I see you and meet me, and they go, "Oh my goodness, doc, your company's so huge. It gets bigger every month. It gets this." I said, do you understand how people come to me? Do you understand how people walk into our offices? They've been through so much devastating stuff that by the time they get there, they're so fed up and so destroyed and hurt and even frustrated with their doctors. I'm sitting there defending their doctors saying, listen, your doctor tried his best. Most doctors in medical or natural field, the majority, the vast majority, yes, I hear the exceptions where there's some doctors that are just jerks. We saw that in politics over the last 3 years. A lot of jerks, okay? But the majority of all doctors, nurses, chiropractors, naturopaths, acupuncturists, all these people are very caring and want to help, okay? And if we could actually get people to think differently, all of us would be needed less. So I know it's really funny. I'm trying to work my way into bankruptcy. And I mean this sincerely, because if we can get people to take active control of their health and understand this, they're gonna need all of us less. We spend $4.3 trillion on healthcare. Everybody talks about the corruption within all the military industrial complex. That's 1.3 trillion. We're at 4.3 trillion for healthcare. You think there's not corruption there? We saw it over the last 3 years. And see, I can say that now with great confidence because I've been saying it's been happening for 30 years. I saw it in the whole vaccine industry for 30 years, okay? It's just that they showed their hand too much over the last 3 years. So now people are coming light to it that way. So I was just telling Chris before you got on, I was never on media till about 7 years ago where my nephew came to me and said, Uncle Patrick, we gotta get you a media. I'm like, I know. And I fought him for 6 months because I'm like, I don't care. I'm dealing with sick people. They're coming in by the droves every single day to all of our clinics. I've been busy for 25 years. And if I wanted to, I could just go back in a room and take care of wonderful women, because that last 10 years, all I took care of was women because all the female hormone issues. So I'm hoping the wellness way doesn't exist 50 years from now. Do I think it's going to be massive? Yes. Because you know why? Because I had a little hope for medicine after the whole COVID thing. But even Pfizer came out yesterday and said the vaccine was a huge success. You say, and I had really hoped for healthcare coming out and saying, you know, guys, we messed up. We messed up. I'm okay with this. I really am. I'm okay if they would have came out and said, hey, we messed up. We did this. And I'm okay with that because I knew that they were crazy in the first place, so I'm not regretting not getting anything that they do. But the idea is but they didn't. They're just doubling down. They're just doubling down. You understand? So what's gonna happen? 1 year from now, I'll probably have double the clinics I have right now. We open a lot of them every single month. I have chiropractors and doctors and nurses opening up Wellness Way offices all over now. So do I see that happening? Sure. But I said my hope would be the fact that I could just go off in the sunset and sit with my kids and my grandkids and stuff and just share stories of what happened in the past. But I see us just continue to get bigger.
Yeah, I think you're going to stay busy. No matter how much we may all wish it wasn't going to be the issue. Where can everybody keep up with what you have going on, Doctor, and you personally?
I always tell people, just go to the Wellness Way website, so thewellnessway.com. It's we just put out a lot of free information. I do a show every Saturday called A Different Perspective. My Instagram, now once again, I apologize. There isn't a media platform I haven't been kicked off. I had a ton of followers on Instagram, got wiped off, but then it jumped back up again. In TikTok, I was huge, got wiped off. YouTube, I can barely put a video on YouTube without getting kicked off. But the idea is but if you go to the Wellness Way website, it's always there. Instagram's probably my biggest thing to do that way right now, just because, I mean, there are millions of people go to our website. But I try to stay up and just giving people good information and reels and things like that. And I always tell people, and then it's just give you information. That's all it is. It gives you information. I'm very proud about the fact that I never try to sell anything to anybody, because if you don't have the understanding, even doing a lab can mislead you if you actually don't have the right foundational thinkings with things. And the nice thing is this, I have my new book coming out, my one book that you mentioned at the beginning. I just came out with 5 years ago and said, you know something, I just disagree with all the stuff they're teaching. This was even before COVID. And within a week, it was a bestseller. Within 2 weeks, it was an international bestseller. And it's been an international bestseller for 5+ years now. And so I decided to come out with our second book to add more information to the first book. So it'll have the information from the first book and more. And that's why it's called I Still Disagree. And the reviews have been incredible, and from major networks and things like that. And we launched that April 6th. And it's just a long format of things I shared today. I just get a lot of detail on how to analyze your body from an individual standpoint, because we have to remember, no two people, even the same condition, have the same stressors, but it can lead to the same results. So that's why individual care is so important for everybody.
Great, Doctor. We really appreciate you coming on and all the valuable wisdom. Any final words, Chris?
Doc, I appreciate you taking the time. Like I said, you're in my mind, someone putting out a lot of very important information that needs to be out there, and you've been doing it for a while now. So hats off to you. We need more people on that team.
Well, thank you. I love your podcast. I continue to watch it, and thank you for putting it out. And I can't wait to share this wonderful podcast on my platforms also.
Great. For Chris Hansen in Miami, I'm Ryan Alford. We'll see you next time.